What causes wheezing sounds during sleep with COPD? Have you ever wondered why some people with chronic obstructive pulmonary disease experience wheezing sounds while they sleep? Let's break it down in a way that's easy to understand. Wheezing during sleep is mainly caused by the narrowing and obstruction of the airways, which is a hallmark of chronic obstructive pulmonary disease. This condition leads to inflammation and damage in the lungs, making it hard to breathe. When a person with chronic obstructive pulmonary disease lies down to sleep, several things can make this airway obstruction worse. First, the muscles that help keep the airways open tend to relax during sleep. This relaxation can increase resistance in the airways, making it even harder to breathe. Along with this, existing inflammation and mucus buildup can narrow the air passages further. This combination creates turbulent airflow, which produces those wheezing sounds. Another factor to consider is that chronic obstructive pulmonary disease often results in reduced lung function. This means that the ability to remove carbon dioxide and take in oxygen is impaired. At night, this can worsen due to decreased respiratory drive and changes in body position. Coexisting conditions can also play a role in causing wheezing during sleep. For instance, obstructive sleep apnea can lead to repeated blockages in the airway. Gastroesophageal reflux disease can irritate the airways with acid, worsening inflammation. Additionally, obesity and nasal obstructions, like allergic rhinitis, can increase upper airway resistance during sleep, contributing to wheezing. The combination of these factors can lead to symptoms such as coughing, shortness of breath, and, of course, wheezing. These symptoms can disrupt sleep and lower oxygen levels during the night. Managing wheezing sounds during sleep for someone with chronic obstructive pulmonary disease involves several strategies. Optimizing lung function with medications is key. Addressing coexisting sleep disorders, like sleep apnea, is also important. In some cases, using supplemental oxygen can help, but it must be done carefully to avoid worsening carbon dioxide retention. Sleeping in a position that reduces airway obstruction, like slightly elevated, can also help improve breathing and reduce wheezing during sleep. By understanding these causes and management strategies, individuals with chronic obstructive pulmonary disease can find ways to improve their sleep quality and overall well-being.